But before I kind of touch on a few different complementary therapies, including CBT or cognitive-based therapy and acupuncture, how about we all just take a moment to look at our breath? So feel free just to take a seated position where you are. Feel free to close down your eyes. And if it feels okay, there's also the option to lay on the ground. But just notice. So just take the time here to feel what you feel. How is your body feeling right now? Perhaps just scanning the body from head to toe. Where is it in your body you're holding any tension? What are the thoughts that are coming into your mind right now? Perhaps coming to tonight's webinar was a bit of a rush. Perhaps today was a stressful day. Now just take notice of that breath. Not trying to change, but just notice. Notice how you're breathing. How is the air coming inside your body? Is it through the nose? Through your mouth? Perhaps noticing the effort of the breath. Is it easy? Is it a struggle to allow the air to come in? Is your breath shallow or is it fast? What parts of your body are moving when you breathe? The breath is one of the first things that you do to come into this physical world. That nice first inhale. And it's the last thing that you do before you leave this physical world. Your breath stays with you for your whole life. Just noticing the sensations of the breath, the temperature of the air you breathe in, the passage it flows. If you are laying on the floor, feel free to place one hand on your chest and one hand on your belly, or even in the seated position. Just notice if you increase that inhalation, a nice deep inhale. Notice the hand on the belly to rise, and perhaps feeling the chest rise. Deep breathing can help focus our mind. There's lots of studies showing that it helps with anxiety. Focus now on every inhale being deeper and longer than the one before, really allowing your belly to expand, the chest to expand. Notice how your body's feeling right now. What's going on in your mind? And using every exhale as an invitation to let go, release any tension. Taking a nice deep inhale here, expanding the belly, opening the chest, and let all of that go on an exhale. Feel free to slowly open those eyes. There's so many amazing different breathing techniques that we can use. One of them that I think is so simple, and it's something you can do yourself, do anywhere, but also provide education with your patients and people that you see in clinics, is breath holding. So if you were to take just a simple breath in and a breath out, and at the end of a breath out, you're going to hold your nose and then count to a few seconds and then let it go and breathe normal. And you can do those as a few cycles. So if we were to give that a go now, so just taking a normal breath in and letting that go on a breath out, and then holding the nose, 2, 3, 4, and then normal breathing, letting go of the nose. Just having a few cycles of normal breath in between. And then once again, normal breath in, normal breath out. And on the end of that exhalation, holding the nose, counting for 2, 3, 4, and then releasing and normal breathing. And you'll find with time, the ability to hold your breath after an exhale will increase. And you'll just notice the changes in your body over time. This is just one of many examples of some breathing techniques